All right, okay, so we are live now in Facebook, right? So how's everyone doing today? Great day, my dear future USRS. Okay, so can you please type yes if I am audible, right? And if my PowerPoint presentation is visible on your end, so type yes, yes, yes. Okay, so I'm just checking if okay my setup is okay, right? So I'm checking for the comments. Okay, so I would like to acknowledge hello Faiza Hill from South Africa. All right. Okay. Okay, so hi everyone. It's me again, Tin, and welcome to our AMN Academy show. All right. So I'm checking our chat box here. Okay, very good. Thank you so much for your response. And of course, I'm thrilled to be back, okay, with our amazing NCLEX community tonight representing IPASS Processing. And I know many of you have joined me in the past sessions, so thank you for coming back. Okay, it really means a lot. Okay, so go ahead and drop, okay, in the comments, okay, where are you watching from tonight? Okay, so kindly type your location here in our chat box. All right, so whether you're in the Philippines, in the Middle East, or somewhere in the United States, okay, already. Okay, so type your location here in our chat box. Okay, we would love to know your location. Okay, so we have here Teresa. Hello, Teresa, watching from Canada. Hello, Milanes. Okay, watching from the Philippines. Okay, we also have here Mercy. Hi, Mercy. Okay, Mercy is from Nigeria. Hello. All right, so yes. So for tonight's session is all about one of the most tested, most tricky, but also most passable topics in the NCLEX, especially okay, the previous weeks now. This is a trending topic for your upcoming NCLEX RN examination. Okay, so this is all about your diabetes management. Okay, so let's check the chat box. Hello, call. All right, so call is from, okay, kindly type your location. Okay, so all right, so I think this is just, an emoji flag. Okay, I cannot recognize the emoji flag. It's a little bit small, okay, on my end, all right? Okay. Yeah, so whether it's your diabetic ketoacidosis or the DKA, your HH&S, okay, all about your insulin safety and critical prioritization scenarios. Okay, we're going to break it all down step by step. Okay, the NCLEX style. So stay with me and interact in the comments and let's master this together. Okay, we have here. Okay, hello Funmi from Nigeria as well. All right, so I'd like to acknowledge our dear future USRNs from Nigeria. Hello. All right, so let's start. Okay, so when we talk about of your mastering diabetes management, okay, so this one is a trending question and topic as I mentioned earlier, right? Okay, so let's start with the basic. It's very, very important that we start, okay, with the basic. Okay, so what you're seeing on screen is, okay, the foundation of our today's topic. Your diabetes mellitus type 1 and type 2, which is a trending question, right? Okay, so let's first define what is diabetes, right? So when we talk about of your diabetes, this one is considered as, okay, it is a chronic condition, right? Okay, this one is a chronic condition that happens when the body doesn't have enough what? Okay, the problem is there is not enough insulin. Yes or no? Yes. All right? Or it can be it doesn't use the insulin properly, right? And what does the insulin do, okay, in our body? Okay, so it's very, very important when you're studying for a specific concept. Okay, so take a look at, okay, a very simple overview, what structure is involved. Okay, and in this topic, it has something to do with your endocrine disorder, right? A trending endocrine disorder, and we were talking about the hormone insulin. Okay, so let's have a brief explanation. All right, so your insulin helps, okay, move the sugar or the glucose from the blood, okay, very good, into the cells, right? Okay, so I'm checking our chat box. There's a lot of comments here. And of course, I would like to acknowledge that. Very good, Arlene. Okay, Arlene. Hello, Arlene. Okay, from Jamaica. Okay, our dear student Arlene. Okay. Okay, it has something to do with the control of glucose, according to Arlene. Okay, yes, very good. Okay, and that's where complication begin. All right, so complication begin when there's a problem in the insulin, right? And again, insulin, it's very, very important. Okay, as I mentioned earlier, it helps move the sugar from the blood into the cells where it's used for energy. Okay, so when there's a problem with the insulin, it can be a hyper secretion, okay, or there's a not enough, okay, insulin, all right. Yes, the sugar builds up in the blood, right? And that's where the complication begins. Okay, so here's a simple way, okay, to remember, okay, your insulin. Okay, take note of this one, ha. Okay, if there's not enough insulin in our body, okay, it might lead to what? Okay, what we call your diabetes mellitus. And we have two types of your diabetes mellitus, right? Okay, if there's not enough diabetes mellitus, and in severe cases, it can turn into, yes, a complication, your DKA, or yes, it can progress to HH&S. Okay, it's a different thing. DKA and H and S. Okay, yes, they are different. Okay, they are both medical emergencies. We're going to discuss that later. Okay, so then what will happen? Okay, if there is too much insulin, okay, what will happen in our body? Okay, type your answer here in our chat box. Okay, I would like to acknowledge, okay, the presence of, so I'm so sorry, I cannot read. Okay, that, I think this one is a Japanese name. Okay, but I would like to acknowledge the presence of our dear future USRN watching from Jeddah, Saudi Arabia. Okay, from Philippines, it's -5 hours, I think, no? Okay, very good. If there is too much insulin, especially from, okay, injections, it can cause hypoglycemia. So when we talk about of your hypoglycemia, low blood sugar, is it dangerous? Okay, is having a low blood sugar dangerous? Yes or no? Okay, I'm just checking. Hello, Kamizi from Zambia. Okay. Okay, hypoglycemia or having a low blood sugar, is it dangerous? Yes or no? Yes. Actually, that one is a medical emergency. Okay, very good. Okay, I'm checking your answer. Okay, here in our chat box. Okay, all right. So let's test your recall. Okay, so again, type your answer in the comments or in the chat box. Okay, on your Facebook chat box. Okay, so which type of diabetes usually starts in the childhood? Okay, any wild guess? Okay, which type of diabetes usually starts in childhood and needs a lifelong insulin? Is it the type 1 or the type 2 diabetes mellitus? Anyone? I'm checking, okay, our chat box here. Okay, I'm checking your answers. Okay, Mercy, yes, very good. Hypoglycemia is dangerous. Okay, question. Which type of diabetes usually starts in childhood and needs a lifelong insulin? Is it type 1 or type 2? Very good. Okay, very good. Mercy. Okay, it's your diabetes mellitus. Okay, that starts in childhood. Okay, diabetes mellitus type 1. Okay, childhood and needs a lifelong insulin. Type 1 DM. Type 1 DM. Later, we will go through, okay, difference between your type 1 and type 2. Okay, this is just a very simple overview. Okay, very good. Okay, very good, Arlene. Very good, Kamizi. That's your type 1. So now, okay, here in our screen, okay, let's take a quick look, okay, of your pancreas, okay? If you are reviewing for a certain concept, okay, you cannot afford to miss, okay, the structure involved because we don't want to memorize clinical manifestations, right? Okay, so if you know the structure involved, it's very important that you must have a brief overview, okay, of a simple function. So that is why, yes, that's your anatomy and physiology. It doesn't have to be complicated, right? But a very simple overview. Okay, so what is the role of our insulin in the body? What is the role of the insulin in our body, right? So your pancreas, okay, sorry, your pancreas, okay. What is the role of your pancreas, okay, that secretes insulin in our body. It is the key player in the blood sugar control, and it secretes different hormones. Okay, aside from the insulin, as you can see here in our screen, yes. Okay, so we have special hormone producing cells, right? Okay, and each type has a different job. Okay, hello Simeon, watching from Liberia, West Africa. All right, hello Sayed. Okay, Astig is also here. Okay, so we have here your alpha cells. Okay, and your alpha cells secretes what type of hormone? Your glucagon. Okay, but this is not our topic, but it's very important that you know, uy, this pancreas also secretes, okay, ayan, glucagon, okay, in the alpha cells. And just a brief overview about the glucagon's job is to raise your blood sugar when it gets low, to compensate. Yes or no? Yes, right? And we also have here your, okay, somatostatin. Okay, your somatostatin, okay, is being secreted by your delta cells. All right. So, what is the role of your somatostatin in our body? Okay, it balances everything out. All right. So it stops both the insulin and glucagon when needed. And this is our focus. Okay, your beta cells produces or secretes insulin. Right? So this is the most important one when it comes to your diabetes. All right? The insulin helps lower your blood sugar by, okay, moving the glucose inside the cell. Okay? It's very, very important that you get, no? Okay, the idea, okay, the role of the insulin, okay, in our body. Okay, all right, it should be, okay, very good. Can you still remember the lock and key method? Later we will talk about of the lock and key method for you to better, visualize the role of insulin in our body. But let me ask, okay, the community real quick, okay, my dear future USRN, which of these cells is directly related to diabetes? Again, a recap, okay, which of these cells is directly related to your diabetes? Is it your alpha cells, your beta, or your delta? Anyone? Okay. A very simple recap. Okay. Type your answer here in our chat box. Type your answer here in our chat box. Mm-hmm. Right? Okay, very good, Mercy. That's your perfect. Okay, awesome. Your beta cells. All right. Okay, very good. Okay, so if the beta cells do not work well or stop working, so the client ends up with what? With a high blood sugar, or that is what we call your hyperglycemia. Okay, hello Grace from Central Zambia, right? So always remember, take note of this one. If there's, okay, a too little insulin, okay, take note, there will be a high blood sugar, risk for your DKA and your HHNS, okay? So too much insulin, okay, so that will lead to a low blood sugar, okay? Risk for hypoglycemia, okay? And take note of this one, a trending topic, okay, on your upcoming NCLEX or an examination. In the NCLEX, hypoglycemia is always a priority. Okay, very good, Arlene. Again, hypoglycemia is always a priority because it can lead to what? It might lead to seizure, to coma, or even death, right? A hypoglycemic brain will die. That's your priority, okay? If there is a case between a hyperglycemia or hypoglycemia, okay, your priority would be, very good, hypoglycemia. Okay, it's your hypoglycemia, not hyperglycemia. So aside from a very brief overview of the insulin, okay, so let me explain, okay, this what we call the lock and key method, all right? So this is the lock and key method. Okay, Tin, what does it mean? What does it mean? Okay. This one is the easiest way to remember, no? Okay, so take note that the insulin, okay, all right, so what will happen? Okay, the insulin puts the sugar, okay, into the cell, inside the cell, all right? Okay, very good. Take note of that one. The insulin, okay, puts what again? okay, puts the sugar, okay, inside or into the cell. All right. So the insulin will act as the key, all right, to open up the cell receptor sites. Okay. And if the cell receptor sites are open already, okay, the glucose as well as the potassium, okay, will enter inside the cell. Okay, so when we eat, okay, our blood sugar goes up, right? Okay, so in response, the pancreas releases insulin. Okay, okay, so to compensate, okay, so that's a normal response, right? Okay, very good. Okay, take note of that one. Okay, so it acts as key to open up the cell receptor sites. Okay, the pancreas releases insulin into the bloodstream when we eat. Okay, because our blood sugar goes up. Okay, so now, okay, look at the image on the screen again. All right, so insulin works like a key again. Okay, and our body cells, okay, they have this receptor site. It's very, very important that we have a repetition. Very important to repeat everything. Okay, for you to have retention because yes, based on research, okay, repetition 3 times. Okay, for you to have retention. Okay, without memorization, right? Okay, so when the insulin binds to the receptor, okay, the key meets lock. So that's the signal for the cell to open its glucose channel. Okay, again, and of course, it allows the sugar as well as the potassium to enter. Take note of that one. Question, okay? Use your chat box or use your comment section, okay, to answer. Okay, question. What happens if there's no insulin? Okay? What happens if there's no insulin or the key doesn't fit? Okay, so what will happen? Okay, okay, option. Let's have an option. Okay, blood sugar goes down or blood sugar goes up. Anyone? Okay, type your answer here in our comment section. Okay, all right, so what is your answer? Answer? Okay, if there's no insulin, what will happen into the body? Ay, if there's no insulin, okay. Type your answer in the chat, okay? Blood sugar goes down or blood sugar goes up? Anyone? Okay. Okay. Very good. That's right. Okay. The blood sugar stays high. Okay, take note of that one, ha. The blood sugar stays high. And that's what happened in diabetes. Okay, either there's not enough insulin or the cells resist it. Okay, so that's what lead to the symptoms like fatigue, what else? Frequent urination and delayed healing. Okay, take note of this figure. Very good. I think, okay, the answers or the chat box, okay, is delayed po. Renelle, watching from CAFG Field, right? Okay, very good, Mercy. Very good, Kamizi. Very good, Arlene. Very good. Okay, so now let's move to let's talk about your obesity. Teen, I'm so guilty, no? I'm so guilty, okay? Let's talk about one of the most common and preventable risk factor for your diabetes again. Yes, okay, you heard it right. Okay, this one is the most common and preventable risk factor, your obesity. Okay, as you can see on the slide, it is okay directly from Saunders. Okay, and it's something okay the NCLEX loves to include in case studies and teaching scenarios. Okay, you cannot afford to miss this. Okay, and you can never go wrong with obesity and of course focus on weight management, something like that. Okay, so obesity means there is excess body fat, and when a person is overweight, okay, especially with abdominal fat, okay, so the body cells become resistant to insulin. Okay, so we have here Bernard. Hello, Bernard, watching from Ghana. Love the topic and discussion. Thank you so much, Bernard. Okay, take note of that one. So even if the pancreas is still producing insulin, the body cannot use it properly if there's a weight gain, okay, or overweight. Okay, weight gain is okay, but being obese na, okay, there's something wrong. I'm not against, okay, obesity, right? But there's a lot of disorders associated with obesity, right? All right. Okay. Very good. Okay. Because of the presence of the abdominal fat, okay, the body cells become resistant to insulin, okay, and this one is the major cause of your type 2 diabetes mellitus. All right, the body cannot use, okay, the insulin properly, okay, even if the pancreas is still producing insulin. Okay, there's what we call insulin resistance. That's our problem. Okay, very good no. Tin, I'm so guilty. Okay. Okay, it's okay. But we're talking about of your NCLEX. Now, let's talk about of the risk factor, okay? So let's talk about of your risk factor. Okay, so let's not forget about the risk factor that puts someone at high risk for developing, okay, high risk for developing metabolic disorders such as your diabetes mellitus. What else? Your heart disease, right? Okay, your metabolic disorders, and of course, heart disease, okay, and your stroke. Right? So these are, okay, the risk factors. Okay. So this is called your metabolic syndrome. And if the client, take note of this one, meets three or more, take note of this one, if the client meets three or more of this criteria, okay, of this criteria, they are at serious risk po. Okay, so it's very, very important. Take note of this. Think of the metabolic, okay, metabolic, okay. Because yes, diabetes is a metabolic disorder. Bowl. All right. So we have here a letter B. Okay. Okay. So think of your BP meds or, okay, or hypertension. So whiten. Okay. A systolic PP of over 130 puts them in a high risk group. Okay. Another one is, okay, another criteria. Okay. Blood sugar. Okay, the blood sugar or, if the patient is taking a blood sugar medication or, okay, increase in the blood glucose, okay, blood glucose or high glucose level. So this includes clients already on insulin or it can be a patient is using oral hypoglycemic agent, very good mercy, or those with fasting blood sugar of over 100. Yes. Okay, what else? Letter O. Okay, what is letter O? Uy, I'm so guilty, Tin. Obese. Okay, especially the central obesity, Tin. I'm so guilty, no? I have truncal obesity. Ay! Central obesity. Hi, not truncal obesity. The truncal obesity is for your Cushing, right? Okay, so that's the waist over, okay, 35 inches, okay, for females. Huy, okay, to be considered as obese. Again, take note of this one. For females, okay, it must be 35 inches and above. Okay, for the waistline, we're talking about of the waistline for the females, and for the males, the waistline is 45 inches. Okay, 45 inches and above. Oh, I'm so guilty talaga, Tin. I'm so guilty. Okay, letter L. Letter L stands for your lipids. Okay, so if you have, okay, a high total cholesterol, okay, LDL, increase in the low density lipoprotein, no? Triglycerides, okay, increase the risk, okay. So NCLEX loves the 200, 150, and 100 rule for your total cholesterol, right? Okay, triglycerides and your LDL. Okay, take note of that one. NCLEX tip: always look for the patterns. Okay, if a case mentions, okay, if a case mentions, okay, BP medication, obesity, high blood sugar, what else, and abnormal triglycerides or lipids, think of what? Okay, metabolic disorder. Okay, you will suspect, yes, there's a high risk. Oh, yes, this patient risk for diabetes or a cardiac follow-up. Okay, so let's make sure we educate our clients early, right? And prevention is better than hospitalization. Okay, so risk criteria, high BP, very good. Wow, learning something new. Of course, Bernard. Okay, of course. Okay, we are learning. Okay, next. Okay, so next, okay, other slides. So this is one. This one is a trending topic. Okay, so let's start. okay, with a comparison, okay? So let's compare the two main types of your DMs. Very, very important to, how to distinguish if it's a type 1 or type 2 DM. Okay, so then what are the differences? Okay, so let's start with your type 1 DM. Okay, what is the cause? If Alex would ask you, what is the cause? Okay, actually, for the type 1, okay, it is an autoimmune disease. Okay, it is an autoimmune disorder or disease, my dear future ESRN. So, meaning when we talk about the autoimmune disease, the body attacks and destroys, okay, what type of cell in the pancreas? Your beta cells in the pancreas that produce the insulin. So, that means little to no insulin is produced. Okay, again, when we talk about of your type 1, take note of this one. Okay, when we talk about of your type 1, if you will be asked for the insulin production, there is a very little, okay, to no insulin production. Okay, so what will happen to our body? Uy, take note, we will anticipate very little to no insulin production at all. Okay, so meaning the glucose or the sugar cannot enter inside the cell. Okay, as well as the potassium. Yes or no? Yes. Okay, hello Hanif from Pakistan. Hi. Take note of that one now for the insulin production. Okay, again, the glucose stays in the bloodstream because there is no insulin to help. Okay, to help move into the cells. Okay, all right. So when we talk about of the onset, let's talk about of the onset. It usually starts in what? Take note of a juvenile onset. So when we talk about of your juvenile, so meaning, yes, starts in children. Think of children, okay? Teens or young adult. But of course, it can happen at any age. And because the body cannot make insulin at all, type 1 always what? Uy, ha? This is also known as your insulin-dependent diabetes mellitus. Why? Okay, because there is a very little to no insulin production. So meaning we are expecting that the management, okay, we want, okay, insulin therapy for life. Okay, management would be the insulin. So now, Tin, what are the risk factors? What are the risk factors? Anyone? Okay. What are the risk factors? Okay. What are the risk factors? Can you name risk factors? Okay. Risk factors. Risk factors. Uh-huh. Okay. I'm looking for the risk factors. Okay. Very good. Okay. So this type is strongly linked to your, okay, very good, obesity. Okay. Yes. Obesity, not much, okay, in obesity, right? Because it's more on the type 2. For the risk factors, still it's genetics, all right, genetics. Okay, family history, very good, because this one is an autoimmune disorder, right? Okay, and this is also known as your insulin dependent, okay, insulin dependent diabetes mellitus. Okay, so meaning, yes, always require insulin therapy for life. It's for life because there is no insulin production at all, or very little compared to your type 2. What happens in your type 2? Okay, so this one is a more common type of your diabetes. Whiting. What is the cause? What is the cause? So actually, yes, okay, actually, the insulin, is there a production of insulin? Is there a production of insulin here? Okay, for type 2. Okay, question. Is there a production of insulin? Yes. There's production of insulin, but the body either doesn't make enough insulin or, okay, the insulin doesn't work properly. Or what we call very good, there is, okay, perfect, your insulin resistance. Okay, one of the most common example is due to what? Obesity. Ouch, Tin, I'm so guilty. Kaya today, right? Okay, for the insulin production, yes, there is. Okay, there is insulin production. Okay, but okay, the body, okay, okay, the insulin doesn't work properly. Okay, doesn't work properly, cannot be used properly. And if NCLEX would ask you for the onset, okay, if you are into reading references, actually the onset of this one is what? Okay, 30 years old and above. Okay, but right now, especially here in the Philippines, okay, the trending samgyupsal unlimited. We love, unlimited, okay, unlimited white. White bread, white rice, everything white. Okay, that causes, yes, okay, blood sugar to shoot up, right? Okay, okay, so there's a lot of cases, okay, that we encounter now. Okay, type 2 diabetes mellitus, type 2 DM, okay, in the 20s, right? Okay, very good. Hello, iba ang Pinoy. Okay, very good, Bernard. That's correct. Okay, that's correct. Okay, if Alex would ask you for the risk factor, yes, very good for the type 2 obesity. Okay, yes, still family history. Okay, still family history. Okay, obesity as well. Obesity, lifestyle. Okay, the diet. Okay, the diet. Okay, lifestyle. Ayan. So they are linked, okay? They are strongly linked, okay, to very good to your diabetes mellitus type 2. Take note of that one. Again, type 2 is more common in adults, okay? 30 years old before, but right now there's no specific age, no? But it's more common in adults. But now, okay, even teens are getting it because of increasing obesity. Right? Work from home pa nga, yes or no? Okay, again. Okay, so let's talk about of the management. Okay, if the management for your type 1 is the insulin, because there is no insulin, okay, what is our management here? What is the management? What is the management? Is it insulin? Of course, your endocrinologist will advise you for 3 months. Now, if, for example, you have a borderline blood sugar, okay, so let's start with, for example, 3 months. Now, okay, let's start with the lifestyle changes like diet, exercise. Okay, because your diabetes mellitus, okay, think of DM, right? The initials are DM. So think of DM. Okay? The management would focus on the diet first. Hi, diet! Ha, sinasabi ko. Diet, okay? Followed by the, hello, Jamie. How are you? Okay, classmate. Hello, Jamie. Okay, exercise and medication. Last would be the medication. Right? And what is the drug of choice for your type 2 DM? Okay, so yes, okay, the most common one, your oral hypoglycemic agents, okay? Then is it possible to switch in the insulin if needed, okay, or in the late stage? Okay, but most likely it's your oral hypoglycemic agents or your very good OHA. Okay, very good. Okay. I hope everything is clear. Okay, very good. All right. So let's proceed to the next slide. It's very, very important. No, this one is a trending NCLEX question, and you cannot afford to miss the principle when it comes to your diabetes mellitus. Why? NCLEX will focus on we'll test your knowledge when it comes to recognizing the cues, right? Okay, very good. Okay, you should know. Is it a symptom of hyperglycemia or hypoglycemia? Very important that you know how to recognize and analyze the cues. Okay, because that's your NCLEX, especially when it comes to your case study, right? So now let's break down the difference between, okay, high blood sugar and a low blood sugar. Again, because NCLEX, you'll always be asked to identify which one is more urgent, no? Okay, so we mentioned earlier, our priority. So first, when we talk about of your high sugar, this is your hyperglycemia. Very good. Your hyperglycemia. Hyperglycemia, yes or no? Yes, all right. So this means there is too much sugar in the blood. You will hear this in NCLEX questions like this client has experienced polyuria, polydipsia, or polyphagia. So that's okay, the three P's. The classic signs, okay? The classic signs, okay, for your hyperglycemia. Your polyuria, urinating a lot, right? Okay. Thirsty, okay, polydipsia, okay, and polyphagia, okay, excessive hunger, polyphagia, excessive hunger, right? So that's the classic signs of your hyperglycemia. Okay, so think of, okay, uy, aside from the three P's, okay, how do we remember it? How do we remember it? Okay, take note that hot and dry. Hoy, hot and dry. The sugar is high. Okay, take note of this one. Hot and dry, the sugar is high. Think of, yes, dry mouth. There's a frequent urination, always hungry, and always thirsty. Okay, aside from the classic three P's, hot and dry, the sugar is high. Now, let's proceed to your, very good, okay, your low sugar or your hypoglycemia, because this is your priority, yes or no? Yes, hypoglycemia. This one is more dangerous and more, okay, this one is more urgent in the NCLEX. So meaning this will be your priority. If we will compare, yes, patients with, in pain, right? Okay, compared to hypoglycemia, yes, okay. Pain, hypoglycemia, hyperglycemia is your hypoglycemia. Again, a hypoglycemic brain will die. Okay, so Tin, what are the manifestations? How do we remember it? Take note of this one, the opposite of your hot and dry. Okay, it's very good. Yes, cold and clammy tin. Cold and clammy meaning the patient needs candy. Cold and clammy needs candy or give them candy. Because yes, that's our management if the patient, okay, is awake. Okay, because the brain needs sugar. And low sugar, okay, is equals to brain that if untreated. A hypogly brain will die. A hypogly brain, okay, will die. Take note of this one. So meaning this is, okay, your priority, a medical emergency. Aside from the cold and clammy, what are the other manifestations? Okay, there's pale, what else? Okay, another one, sweaty skin, very good. You should know how to recognize the symptoms of your hypoglycemia. Okay, so the patient manifests shaky, diba? Being shaky, what else? Shaky, hungry, very good. Hungry as well, yes. Okay, anxious. There's excessive hunger here, no? Right? Okay. Headache. Okay, headache. Okay, very good. What else? Perspiration, very good. And that's your sweaty skin. Very good, Bernard. Okay, paleness. Okay, ayan, irritable. Okay, irritable as well. Your patient is irritable and weak, no? You can also use the acronym he wash. He wash. Or high wash or he wash. Okay, ayan. So, this is your acronym, no? Okay, headache, irritable, weak, anxious, sweaty, and hunger. Boom! Okay, cold and clammy needs candy. This is an emergency. Your priority. Yes or no? Yes, very good. All right. Okay, are you still okay? Yes, Tin, I'm having a hypoglycemia na. Kaya today. Kaya, ear hunger. Okay, very good, Arlene. All right. So, okay, if Alex would ask you for the common causes, okay, of this hyperglycemia, what are those? What are those? Very good, your sepsis. Okay, sepsis, another one, stress. Okay, stress from what? It can be stress from surgery, right? Yes, it can be stress from a prolonged hospitalization. And of course, skipping insulin, yes or no? Skipping insulin as well, no? And the use of steroid, very good. Steroid, example, your prednisone. Diba? Your prednisone, okay? If NCLEX would ask you for the treatment again, okay, treatment, okay, in general, okay, that would be, okay, insulin. And it's a priority. Insulin, and this is a priority. Okay, very, very important yan. Okay, now let's proceed to your low sugar. For the low sugar, okay, if Alex would ask you for the causes, okay, think of exercise. What else? What else? Okay, alcohol, very good. Okay, alcohol. What else? Yes, insulin during, okay, peak times. Okay, insulin. Okay, insulin peak. Okay, very good. Right? So take note of this one. If Atlas would ask you about insulin, we have a separate session of your insulin because it's kind of long, right? But think of, okay, your peak, Okay, why? Okay, so for the parameters, you have the onset, you have the peak, okay, duration, something like that, no? It's very, very important to take note of the peak. Why? This is when the hypoglycemia, okay, will mostly likely to happen, right? And it's very, very important to assess your patient, no? Okay, if having a very low blood sugar, you should know the management, right? Okay, very good. Okay. If NCLEX would ask you for the treatment, it's very important again to what? Assess your patient. Okay? Uy, assess your patient. Assess if your patient is uh, uh, awake. If awake, what are the management? Okay? Give what? Give simple sugar. Give simple sugar. Hypoglycemia. We're talking about of your hypoglycemia, right? Okay, simple sugar like juice, okay, soda, right? Soda, what else? Okay, very good. Crackers, okay, low fat milk, okay, low fat milk, okay, low fat milk. Take note of that one. But okay, yes, not peanut butter or full fat milk, no. So those digest too slowly. Okay, it must be a simple sugar, but the classic one is your juice or soda, right? Okay, and what if your patient, okay, upon assessment, okay, they are, it's, okay, your patient is asleep. Okay, you give D50 IV, okay, D50 IV, right? Okay, D50 IV, so we say if they cannot eat, stab them with D50, yes or no? Yes. Okay, who is your priority? Hypoglycemia is your priority. It's very, very important to know your signs, your causes, and your NCLEX priority action. Okay, NCLEX loves to ask about hypoglycemia. Okay, take note of that one. And this one is from Saunders. We cannot afford to miss this one. Okay. What does it mean, teen? What does it mean? All right. What does it mean? Okay. Okay. So this one is from Saunders. Okay. So if your patient, okay, is for example semi-conscious, right? Can we ask them, okay, to swallow food? Okay. Semi-conscious. Okay, can we ask them to swallow foods or any fluids? No. All right. Uy, semi-conscious, no? And then, the patient is, looks like the patient is awake. Uy, but upon assessment, it's semi-conscious. Okay. Again, if the patient is semi-conscious, do not give oral food or fluids. Why? Because the patient cannot swallow or fully, the patient is not fully awake, semi-conscious, eh. Alright, so why? Because they are at risk for high aspiration, yes or no? Yes, okay, they are at risk for aspiration. The management, same as for the unconscious patient. Same as for the unconscious patient. Very good, Iba ang Pinoy. Very good, Arlene. Awesome. Alright. Okay, so let's have, okay, a quick discussion of the treatment. Okay, so when we talk about of your diabetes mellitus in general, our focus would be the diet, all right? And then what is the diet? What is the diet? We will focus, okay, the diet should be, okay, focus on low carbs. It should be low carbs, ha, hoy, ha? Then I will join low carb group, intermittent fasting, oy. Okay, especially the simple sugar that raise the blood sugar quickly. Okay, ha? Okay, it's a big no-no. It should be low carbs. Okay, what to avoid? Anything white. Okay, anything white. Okay, it's a big no-no. Right? So what does it mean? White rice, white bread, anything, white pasta, something like that. Fruit juices, all right? They are not ideal for diabetics, okay? Okay, so the best choice, okay, teach your clients to choose high fiber. Okay, high fiber. Okay, high fiber, wheat, grains, no? So think of brown are better. Okay, your grains, wheat bread, right? And white is worst. Okay, take note of that one because brown, okay, example, your brown rice, your whole grain of bread, your peanut butter, okay, look for a word with whole, okay, wheat grain, something like that, ano, okay. High in fiber, high in fiber. Okay, so what else aside from the low carb and the browns? Okay, we will focus on the diabetic fit. We will focus on your diabetic fit. Why? This is the favorite of your NCLEX. Okay, when it comes to your diabetic fit care, food care. Okay, very, very important. And what is our goal? What is our goal in diabetic foot care? To keep, okay, the feet, okay, keep the feet clean, okay, clean and injury free. Okay, clean and injury free. Anything that has something to do, okay, injury free. Okay, anything that has something to do with maintaining the skin integrity of your patient, that would be the best answer. Okay, so for example, right? So what to avoid? Okay, example, flip-flops, no, flip-flops, no, it's a big no, ha? Like the use of a nylon socks, no, high heels, no, they are, okay, this increased risk for injury. Okay, so what is the best choice? Use, okay, a closed, well-fitting, okay, closed, well-fitting, no, well-fitting, it should be well-fit, okay, shoes, and it should be a soft cotton, okay, not a nylon, something like that, okay, a soft cotton socks, all right, okay. The over the counter corn removal, it's a big no-no. Corn removal, it's a big no-no. What else? Okay, avoid overly hot bath, okay, the overly hot bath, okay. But we all know that patients with diabetes, they have decrease in the sensation, especially in the distal part of our body, but it's okay. They have a poor circulation. It should be warm, okay, not overly hot. Overly hot baths, okay, the heating pads, no. Again, they have a poor circulation and may not feel the burns. It should be warm bath is okay because it promotes circulation naman, but overly hot bath, heating pad, it's a big no-no. Okay, preventing toe injuries as well. How? Okay, all right. It's very important to clip the nails straight across. Okay, ha? Straight, ha? Okay, not curved. Okay, don't go digging into the nail beds. Here in the Philippines, it's the ingrown, right? Okay, so when it comes to your diabetic feet, it's very, very important to focus on your feet. Okay, if Alex would ask you, no? Okay, so what are the big things when it comes to your foot care? Okay, is it okay if if you encounter, inspect the feet weekly? Hi, not weekly. It should be a daily inspection, not weekly. Favorite of your NCLEX, no? Okay, again, use a soft cotton socks, not nylon. Okay, soft cotton, not nylon, right? Okay, wear a closed shoes that fit well, no sandals. All right. Okay, nails trim straight. Okay, not curve, no angle. All right. So no rubbing or callus removal. If there's a non-healing wound, report it to the HCP. Report it to the HCP right away. All right. Very good. Okay, so I hope everything is clear. Okay, sige. Okay, now, let's proceed to your, okay, we cannot afford to miss this. Okay? We cannot afford to miss this. Okay? Your DKA and your HHNS. We still have 12 minutes. Okay? This is a trending NCLEX question. Okay? So, when we talk about of your DKA, okay, your DKA or your diabetic ketoacidosis, what is this? Okay, so this one is a complication of your type 1. Take note of this one, ha? Okay, this one is a complication of your type 1 diabetes mellitus. Okay, yes, more common in type 1 DM, and this one can become a life-threatening if not managed quickly. Right? So, what are the manifestations of a patient with TKA? Okay, take note of this one. Okay, of course, there's a dehydration. Take note of that one. Letter D, there's a dehydration, no? And because the blood sugar is, okay, ranges from 250 to 500 milligrams per deciliter. Of course, increase in the blood sugar, yes, okay, prone to dehydration. Okay, clients are very dehydrated, right? Okay, so what else? What else? Aside from the dehydration, okay, when we talk about of your letter K stands for, okay, this one is classic for your DKA, presence of ketones. If there's presence of ketones, okay, take note of your cosmos respiration. Take note of this one, ha. Okay, so meaning there's a rapid, deep breathing, okay, with a fruity smell, Okay, take note of that one. There's a fruity smell. Ha? Okay. So that's due to the body, okay, burning fat and creating ketones or ketosis. Very good. Iba ang Pinoy. Alright? Okay, take note of that one. What else? Uy, we have a problem here. Again, what happens in type 1 diabetes mellitus? There is a very little to no insulin production at all. So meaning, aside from the blood sugar that stays in the blood, also the potassium, okay, we will expect that the potassium, okay, yes, is high. Okay, we have an elevated potassium, okay, or hyperkalemia. There's a hyperkalemia here, okay, hyperkalemia. Okay. All right. Hyperkalemia ha. Okay. What else? What else? Okay. Letter A. Letter A. So we have here your acidosis. And of course, we all know that diabetes is a metabolic disorder. We'll expect that this one is a metabolic acidosis, right? And of course, there's a process of ketone in acidosis. We'll expect that there's also an abdominal pain. So these are the big things for your DKA. All right. So anything that reflects, management of the blood sugar, okay, fluid resuscitation, okay, that's correct. Okay, that's correct. Okay. All right. So I hope everything is clear for your DKA. Okay. So now let's proceed to your H and S. Okay, we still have, okay, sige, 9 minutes. Okay, so Tin, what are the differences between your DKA and HH and S? So this one is the complication of your type 2 DM. Okay, take note of this one, ha? And the problem here is that, okay, it has, okay, the highest blood sugar. Okay, the highest, okay, blood sugar of over 600 actually, okay, of more than 600 milligram per deciliter. Okay, so meaning, huy, compared to your DKA, what is the problem here? Okay, uy, when we define HH and S, this is your hyperglycemic, hyperosmolar, non-ketotic syndrome. Take note, it's a non-ketotic. Okay, and we have the highest blood sugar. Okay, so meaning, huy, there is a higher fluid loss that will lead to extreme dehydration. So meaning anything that has something to do with the fluid resuscitation, that would be your priority. Okay, if NCLEX would ask you for what type of insulin, okay, yes, this one is applicable for your DKA and your HH and S. It should be, yes, very good. Not a long-acting ha. Do not give a long-acting insulin because this one is a medical emergency. It's already a complication. Okay, we need a medication, okay, that acts as soon as possible or immediately. All right, so that's your regular insulin IV. Take note of that one. Ha? Hoy! Ha? Okay, so again, there's no process of ketones here. So meaning we will not expect that there's, okay, abdominal pain. So no abdominal pain, no ketones, okay, no acidosis, no fruity breath, okay, no cosmos respiration. Okay, so how about the potassium? Okay, so actually here, okay, when we talk about of the potassium, most of the time, okay, for the early stage, we have a stable potassium here. Okay, we have a stable potassium here. Take note of that one, ha? Okay, so what else? Previous NCLEX tip or question? Okay, aside from your extreme dehydration, another tip, no? Okay, there's change in the, okay, change in, okay, mentation or neuro, okay, which is your confusion. All right, neurological manifestation, confusion. Boom. Okay, it's your H and S. Okay, the different what's the big difference for your DKA? There's a process of ketone. Okay, our problem there's a hyperkalemia here. Okay, there is an extreme dehydration. Okay, it has the highest blood sugar. Okay, so most likely, yes, we have a stable potassium here. Right? Okay. Yes, fluid resuscitation is our priority. Fluid resuscitation is our priority. Okay. So for you to compare, okay, yes, the difference between your DKA and HHNS, we have here, yes, the diagram. All right. Okay. All right. So, grabe. Whoa. So that was a power pack session. So thank you so much, my dear future ESRNs, for staying with me today on AMN Academy show. So we just walk through everything from the basic of diabetes all the way to life-threatening emergencies like your DKA and your HHNS. All right. Sige. So we walk through your insulin diet, diabetic feet, sugar crashes, what else, and flex tips. Okay, that you can apply right away. So tell me in the comments here in our chat box, what was your biggest takeaway from tonight's session? Okay, I want to hear from you guys. Okay, so what was your biggest takeaway from tonight's session? Okay, so what is your biggest takeaway? All right, so kindly type your answer here in our chat box. Your biggest takeaway from tonight's session. All right, so let me hear from Bernard. What's your biggest takeaway? Right? Sige. Type your answer here in our chat box. I would like to hear from you guys. All right. So, hi, Moody. All right. So, type here. Okay. The regular insulin. Regular insulin. Okay. Very good. Okay. DKA and HHNS, a difference, right? Okay. So very, very important to take note of all of this. This one is a trending NCLEX question. All right. Okay. So again, okay, that will be all for today. Again, I'm Teen from IPASS Processing, and I'll see you again in the next live class. Again, stay focused, stay confident, and as I always say, you can pass the NCLEX in 85 because you're made for this. Thanks again for joining us at AMN Academy Show. Good night, future USRS. Bye bye.